Hi, my name is Michelle. I'm going to be your EPCC student nurse, and I'm going to be doing a wound dressing change. Alrighty, can I get your first and last name, please? Alrighty, thank you. And if I can go ahead and get your date of birth. Okay, great. Thank you so much. I'm going to go ahead and put on my gloves. These are just regular clean gloves. Okay, now I'm going to go ahead and check your JP drain, which is located below the wound. And then if it is full, then you'll want to have a cup so that you can go ahead and drain the JP and then close that up, make sure it all drains up. Then you'll clean the port with an alcohol pad and squeeze, and then cover it again, close it. And then either place it below, pin it below the wound so that it can drain down. Then you will put that on the side, closed in the specimen cup. Then you would come over here and you're going to examine the dressing itself. There's nothing coming out of the dressing of the ABD ab pad. You're going to start removing the tape from around. How are you feeling? Okay, great. So I'm going to go ahead and remove it. And then you're going to notice the drainage. Right here, this is serosynguineous drainage, which is normal. It doesn't have a bad odor. It is moderate. It's a moderate amount. And I'm going to go ahead and toss this in the receptacle, the trash. I have one right here. And then I'm looking at the incision. Okay. It doesn't appear to be inflamed, red. How does that feel? Okay, I'm just touching around, not near it. Then I'm counting the staples. I'm going to take a mental note that there's 19. So now I'm ready to go ahead and prepare my sterile field. I'm going to go ahead and take off my gloves, throw them in the trash for hand hygiene. And I already did examine my package on the way over here, but I'll do so again and just make sure that it's not opened. The date, the expiration date is 7/31 of 2020. So now that I have this, I'm going to go ahead and open it up. Throw that. Then I'm going to go ahead and just push down on the glove so I can bring this up. Move this to the side. I'm going to go ahead and open it up. Just being very careful to try to strain it out. Then I'm going to grab this glove with my non-dominant hand. And they were in the car, so they're a little stuck to each other. So I'm going to put my dominant hand in here so I can get this glove on. Have a little bit of a difficulty touching inside only. Then I want to grab this one with the with this hand. I didn't touch any other part of the glove. Then I'll have it like this. Then I want to put this hand in here. Having a little bit of difficulty. I'll use this to bring it up. Now that I have it, have a little bit of technical difficulty, but since I have the sterile glove, I am able to go ahead and fix it now. Then I'll grab this, throw in the reciprocal, and now I have my other gloves, and I can start taking everything out. I want to open it and make sure I'm not touching it all over the place, but I do want it to open. Then I'm going to lay it over here. And this is going to be my sterile field that I can now bring the items that I need over. So the ABD pad, this side is always going to go facing up on the patient. We have the red bag that we're not going to use, the gauze that we're not going to use, and then we have the measuring device. We have the tape that we can just drop right there. The other tape, we're going to use this after. And then we have the tape as well that we're going to use after. Then we have the gauze that we're going to open up, and we're going to go ahead and separate them. It's going to be 1, 2, 3, and this is to dry the incision. This is going to be 1, 2, to place on top of the incision. And then we have 1, 2, I'm just separating these. We need at least 3 so that we can clean the wound. Those will go back in here. Then I will get the sterile normal saline. And this, we have 8/1 of 2020. I'm going to go ahead and open it. Throw it in the trash. And I'm going to go ahead and peel back. I'm stepping away from the sterile film. Throw that. Then I'm pouring this on top of the gauze. Throwing that away. Then what I'd like to do is with this hand, I'm going to go ahead and grab 1 and remove excess saline. I'm going to pass it over to my hand, and this one I'm going to go ahead and wipe from the top to the bottom and then dispose. I'll grab my second one. And remove the excess saline from it. And pass it over to my hand. And then do the other side Then I'll grab the last one, squeeze the excess saline, undo it. It's kind of hard to unfluff it. Easier with the little sticks. Then I'll pass it over to this hand and then do the other side from the top to the bottom. Then I'll come over here and grab one, pass it over to my hand, and from the top to the bottom, and then from this one to this one, from the top to the bottom, and then this one from the, pass it over, and then do the other side from the top to the bottom. What I did fail to do was measure my wound. I should have measured the wound before I started doing the cleaning. I did get a little nervous, but I would measure the wound first and then get rid of the clear measuring tape on it. I did measure it prior and it was 4 inches. Now what I'm going to do is I'm going to grab this one and I'm going to go ahead and place it on top of the wound, and then this one as well on top of the wound. And now that this one is still sterile, I'm going to go ahead and grab the ABD pad and I'm going to put it on top of the wound. Now I can go ahead and discard my gloves. Hand hygiene. And then since this is a non-sterile part, I can go ahead and apply the tape without my gloves. How are you feeling, Mr. Esposito? Good. Okay. Then on this side as well. I don't have that much, I don't have any more tape on this one, so I'm gonna go ahead and use this tape for the ends. And I'm gonna place it here and here. And of course, I didn't have orders to remove the JP drain, so I'm leaving it intact. Of course, you would also check that to make sure it hasn't came out, make sure the stitch is still there. And then lastly, you'll want to put your initials, the date. Today is 5/5/20, and it is 13/34. My initials, EPCC student nurse. Then I'll go ahead and remove this and apply this on the side where the tape is, where the dressing. Then I'll go ahead and get rid of all this. Hand sanitize. And that completes my video. Thank you.